Now, an ABC4 News special, COVID-19 Lessons Learned with Dr. Angela Dunn.
Thanks for joining us for this special edition of ABC4 News. I'm Jason Wynn. There's a lot of concern around COVID-19 and questions that need to be answered. Joining us to answer those questions is Dr. Angela Dunn, the Executive Director for the Salt Lake County Health Department. Dr. Dunn, thanks for joining us.
Yeah, happy to be here.
All right, well, I'm going to get right down to it because there's been a lot of stories that we've been talking to nurses and doctors and aides about. And one nurse tells me,
our hallways once again are kind of lined with carts and PPE and all the machinery and equipment and things we need to take care of these COVID patients.
Another doctor from another hospital says,
we're definitely expecting more hospitalizations.
In your mind, what's the state of COVID-19 in Salt Lake County?
Yeah, unfortunately, we're back to a surge again. I mean, we haven't had this many cases or hospitalizations since our winter surge. And it's really, really disappointing because we've got the silver bullet, right? I mean, we've got that vaccine that works so well, yet here we are about to start school again and in the beginning of what's probably going to be a really big surge.
Why are doctors saying that it's going to get worse before it actually gets better?
Because the spread is happening so quickly. This new Delta variant is so much more transmissible than the Alpha variant, which is what we were all accustomed to last year. So it's about 5 to 8 times more transmissible. That means that it's gonna spread through susceptible communities really, really quickly, causing more hospitalizations and unfortunately more deaths. And that spread's happening right now, and it's going to be tough to curtail it.
Now, I want to talk more about the Delta variant, but let's get to that in a second. Garth Brooks, country music star, was recently in Salt Lake City, is talking about canceling his stadium tours. The state keeps coming out reporting somewhere, give or take, 1,000 cases a day. Could we be seeing the gatherings from the July 4th, the concert, and Pioneer Day weekend all coming in as one?
Absolutely. I mean, we saw this last year too. With every holiday, a couple weeks later, we see a surge. And this is exactly what's happening all over again. It's really important that we look at the lessons we learned last year and apply them now so that we save lives.
Well, I want to talk about a lot of those lessons learned, but the Delta variant, you just kind of hinted on it. What's the difference with the Delta Plus variant?
Well, we know that the virus is going to mutate. That's what viruses do. Delta Plus is another variation of the COVID virus. But here's the thing, the more susceptible people there are, the more unvaccinated people there are in our communities, the more quickly the virus is going to spread and change and get stronger. And that's what's happening with the Delta Plus. So there's not a lot of spread yet, so we don't know the exact implications of it. But what could be happening is, in addition to Delta, which spreads more quickly, it could actually have the ability to evade the vaccines. And that's what we really want to avoid. And the best way to do that, of course, is to get vaccinated so it doesn't spread at all. But any of these mutations are going to be scary moving forward.
Well, how far down the Greek alphabet are we going? Because we have the Lambda variant, the Epsilon variant. I mean, there's a few more there.
I mean, this virus mutates constantly, and that's normal for viruses. So they only name them when the mutations have a significant mutation that causes either a change in how it acts or a change in how it impacts humans. And unfortunately, because our vaccination rate is relatively low, we're going to have to keep going down that Greek alphabet.
Unfortunately, we've got to talk about the deaths too, because we're approaching 1,000 deaths. Hearing that so many people have become victim to COVID-19, what's that make you feel inside? It's
really hard because we know that these deaths are preventable for the most part, especially now, especially with the vaccine available. I mean, our 70 plus population is largely completely vaccinated. So we're really seeing deaths in young individuals that don't have to happen. And so it weighs on me constantly about what can I do as a public health professional, as a health officer, to help people understand the gravity of the situation and the benefits of vaccination.
Well, let's talk about some of the help that you can do. Underneath your chair is a little map of Salt Lake County. Looking at the issues in Salt Lake County, what are you seeing in the different parts of the county, and how can we help tackle some of the issues in those different parts of the county?
Throughout this pandemic, our county has been experiencing higher case rates and more morbidity and mortality in our west side, our most under-resourced communities. they continue to share a huge burden of disease with high case rates and low vaccination rates. But our southern part is now leading the way in high case rates because their vaccination rates are so low. The east side of our county is some of the highest vaccination rates, and they're seeing the benefits of that with really low spread of COVID-19. But what's interesting, so I spoke with the mayors of all of our hotspots to figure out what's going on. What can we do better? The west side has a historic distrust in the government, right? Not unfounded, that we need to do a better job of fixing so that we can help our communities be more resilient in terms of responding to emergencies. And to do that, we're working with trusted voices within those communities, the community-based organizations, the faith leaders, our community health workers are going out there. It's been a really effective response on our west side. The South is interesting because what we're seeing there and we're hearing from the elected officials there is that it's really a political divide where individuals think that COVID is over. They think that a lot of government officials are lying and that all we're trying to do is limit their ability or limit their freedoms. And that's a harder thing to overcome. You know, we've seen throughout this pandemic the impact of the political divide on how we're able to respond, and that's happening in the southern part of our county. And honestly, it's really scary, especially as some of our biggest school districts are there as well, going into the fall and potentially having even more spread among our youth.
How do we help send positive messaging that way so that people can start to understand things like the vaccination and it works, or masking and how important that is?
Definitely can't keep coming from me. We need a variety of voices out there. We need individuals who look different, who come from different walks of life, who have different political and religious beliefs, to all come together in a unified message. And I think we're starting to see that on the national level with some of the news media outlets and some of the important political figures out there. We need to do that on the local level as well. And our leaders in those communities need to understand their power and their impact on their communities and take it upon themselves to be that unifying voice.
Coming up, Dr. Dunn and I talk about the 3 vaccines and boosters. We'll see you after the break.